Hi, I'm Dave Scott for BioAstin, and this is the first round of hopefully a lengthy series of questions that I get from all of you. And if you'd like to go to the BioAstin website and just submit your questions to Ask Dave, that's me, or to come to my website, you can do that, and I'll periodically post these questions on both the sites and hopefully answer some of your technical questions, not just on nutrition, but training, racing, all elements of health. That's kind of my expertise, and if I don't know anything, I'll make sure I say that, or I'll go out and search for the proper answer. I did get a couple of really interesting questions. One was on knee pain, and without reciting the author of this one, he said he had 30 minutes into his bike ride, he was experiencing lateral knee pain. And my first response was, well, golly, that's pretty soon. You're not loading it like you do on run. But typically that knee pain, and what he alluded to was the IT band, which is a real fibrous connective tissue that runs down from your hip flexor, your tensor fasciae latae, which is up here on your hip, all the way down to this femoral condyle, which is this little bony prominence. So it's that IT band along here. And a lot of times that pulls your knee laterally. And the reason that you're getting this pain is that this muscle, your glute muscle, is weak. And so as you start pedaling down at 3 o'clock on that pedal force, that knee wants to rotate in medially or towards the top tube. And as it does that, it kind of pulls on that IT band. It really works your rectus femoris or your quadricep, but your glutes are not firing. And also your vastus medialis oblique, that's this muscle on the inside right there, is also weak. So these two control stability in your knee. So you've got to start doing your glute exercises, and the second thing is to make sure that you're stretching your back and your hip flexors. A lot of times the low back is real tight, and if your hip flexors are tight, it kind of pulls your hips in this position, and a lot of times we get sort of an anterior tilt. So I'm really exaggerating if I'm on my bike like this, and I've got this bowed back as opposed to a posterior tilt. So I'm anteriorly tilted because my hip flexors are tight, my glutes are really weak, and consequently you're feeling this pain down this lateral side, particularly on the lateral side of the knee where that IT band is. So get after your glute exercise. I got a whole host of them on my website. I have a lot of videos on glute exercises if you'd like to take a look at those, and hopefully that will help. The last and final thing is make sure that you're not flexing your toes in your shoes. You want to make sure your toes are open when they're in their shoes, and one of the things that you can think about when you're applying pressure on that pedal stroke is actually to lift your toes off the surface of the pedal. So kind of use your imagination. If this is my pedal, here are my toes. If I flex my toes like that and grab my toes, that causes a lot of tension all the way up through that whole chain from my calf all the way up on that lateral side. If I keep my toes up and I feel as though I'm pushing forward, so the pedal stroke is more elliptical, like a watermelon, then as I push down at 3 o'clock, that can innervate my glutes. Maybe I should say one final thing. Sit tall on that bike. Don't slouch. Don't have that anterior tilt. Keep that section open from the base of your ribs to this little bony prominence on your hip bone called the iliac crest. So this base of the ribs to the iliac crest, I want to keep that open when I'm riding. I never want to feel like I shorten it by slouching on that bike. When you open that up, that deep corset-like muscle called the transverse abdominis is going to help stabilize your hips, your core, and you'll be able to activate your glutes. Hopefully that will take care of your knee pain.